Hi, how are you doing today?
Hi, I'm good.
Good. I'm Mary. I'll be your nurse today.
Nice to meet you, Mary. I'm Erica.
Hi, Erica. So I'm just going to go over some, we're going to be filling out your health history chart today.
Oh, okay.
And I just want to get some basic information to start a baseline just so the doctor can kind of get an idea of the past and current health conditions so we can better assist you today, okay?
Oh, okay, cool.
Sound good?
Yeah.
Okay, great. So can you just tell me your full name and your birthday, please?
It's Erica Fortes, and my birthday is 11/18/1993.
Okay, great. Thank you, Erica. So what's the main reason for your visit today?
I have this really bad stomach pain. It's burning all the damn time. And then like my eczema, it's like flaring up. Like you can see like my skin's red right here. It's red right here. And just, it's a lot right now. Like it's completely affecting how I sleep and how I do life. I mean, school and work, it's a lot right now.
That sounds like a lot. I'm sorry to hear that. So have you ever been like diagnosed with like eczema or been treated for it in the past?
Yeah, so like my dermatologist gave me like a formal diagnosis when I was like 3, which kind of sucked, honestly.
Yeah.
But I mean, like I use like what's it called? A specific lotion. I forget like what the name is, but it's helping. But just like when I'm stressed out,
It
like
just kind of
it flares up,
yeah.
and like my stomach hurts too more, and it's just like I don't want to deal with it anymore.
Okay, so I'll definitely make a note of the stomach concerns, and then we'll see what the doctor has to say about that after we collect the additional information that we need. So just the main concern being like burning stomach pain, and on like a scale of 1 to 10, what's the pain at right now?
Right now, it's probably like at an 8. Like I'm talking about it, I'm thinking about it. It sucks. Like it's it really sucks.
I'm sorry to hear that. I know stress can really cause a lot of disruptions in our life. Okay, so I'm just gonna go over the questions with you and let me know if you have any questions about what I'm asking you. Okay. Are you currently taking any medications?
Yeah, I am on orthotricycline.
Okay.
And I take that like once a day. Yeah.
Okay. So it's gonna be the birth control. And let's see, do you take any vitamins or anything else like that? Or not really.
No. Should I take them?
I mean, it's up to you. I mean, I just wanted to take a note of anything else. Vitamins, I mean, they could be an additional, help just to help boost your immune system.
Okay. I'll ask my doctor about that though. I mean,
okay,
not a bad thing.
Okay, and then do you have any allergies to medication or any food or?
No medications as far as I know, but to food, it's seafood and peanuts too.
Peanuts and seafood, all right. And then if you could just tell me the date of your most recent immunization.
I'm up to date on all of them as far as I know.
Okay.
I got my Hep B series all figured out last August, and then I got my flu shot in August too. That kind of sucked actually. I got flu symptoms after that.
Yeah, I know.
Kind of sucked.
Okay, so I'll just make a mark that you are up to date on all your vaccinations and immunizations, and that you've got the most recent flu shot, so that's great. I know sometimes the side effects can be a little funky, but hopefully the better will outweigh the bad. Okay, so, and then have you had a mammogram?
What is that? What?
Mammogram is going to be like a breast exam. It's kind of like it's just kind of like preventative for breast cancer. It just checks the breast tissue.
Oh, okay. Well, no, I've never done that.
Okay, well, we do, you're kind of young, so I don't think you will need to have a mammogram anytime soon, but we do recommend that you do breast self-examinations just to kind of feel the breast tissue and make sure that there's nothing abnormal. If you feel any lumps or any tenderness, that would be of concern. So I can definitely give you information about that. We do recommend that you check not only the breast tissue, but all the way up until the axillary region, or the armpit, should I say.
Okay.
Just to make sure that everything is checking out normally, okay?
Okay, cool.
Just kind of preventative measures for breast cancer.
Okay, cool. I can try doing that. So yeah.
Sounds good. And then have you had a pap smear?
Yeah, I have.
Okay.
So I get those once a year.
Already?
The last one I got was in April, I think, April this year. Yeah.
Okay, so mark down April 2017, and the results came back normal?
Yes.
Sounds good. Perfect. Alrighty. And then have you had any pregnancies?
No.
No, okay.
Thank freaking God. Now, can't do that in nursing school.
Can be additional stress, that's for sure. Okay, so the age of the start of your menstrual cycles?
I was 11. Yeah.
Okay. And then you're still resuming a regular
cycle,
Okay.
yeah, once a month.
And then I'm just going to ask about a couple of personal medical history, just on diseases that might have, been affecting you.
Mm-hmm.
So, have you had any heart disease?
No.
Okay. Asthma or lung diseases? No. Great. High blood pressure?
Yeah. In my past, because I was like kind of bigger before, so I had like really high blood pressure, and that kind of like affected it.
Okay, so you had high blood pressure due to just being like a little overweight?
Yes.
And how about cholesterol?
Cholesterol too. So those were like back in the day, like 2014.
Okay.
I'd probably say that I had high blood pressure, high cholesterol, and that should have been everything.
Okay,
Yeah,
and with the weight loss, have you seen like improvement so far? Like,
yeah, definitely. So like, just exercising and eating right, like definitely like totally good with my weight
helped a
now.
lot. So it's been resolved since then. You feel like okay,
for sure.
great,
Yeah.
great. So any history of diabetes for you?
No, thank God on that one.
Okay, and then thyroid problems?
No.
Kidney disease?
No.
And cancer?
No.
No. Okay, great. Any history of surgeries for you?
Nope, I'm clean on that.
Great. Okay, and then I'm just going to ask you a couple of questions about your family medical history, just to kind of get an idea of if you're predisposed to anything, or just to kind of get a background on your family.
Oh. Okay.
So, if you could just tell me, I'm going to go down the list and just let me know if it's like if it's affected a parent, grandparent, or sibling, anything like that. Nothing specific, just a general statement. Okay.
Okay.
Alcoholism?
No.
No. Great. Cancer?
Yes. It was my grandparent.
Okay. And then heart disease?
Yes, parent.
Okay. Depression, suicide?
Yes, parent.
Depression, okay. Genetic disorders?
No.
No.
No, I don't think so. No.
Okay. Diabetes?
No.
Okay. And does high cholesterol run in the family at all?
Yeah. So it was me, and then like my parents too, and then I think my grandparents, but like mostly my parents. Yeah.
Okay. And then high blood pressure?
Yeah, my parents for sure.
Parents, okay. Anyone in the family have a stroke?
My grandparents.
Okay, sorry to hear that.
It's all good.
And then any bleeding or clotting disorders?
Yeah, like my sister, she has like real issues with like her bruising and all that junk. Yeah.
Okay. And then any asthma?
No. The
Okay.
one thing I didn't get. Yeah.
Okay, and then how about your caffeine intake? Do you drink any coffee, energy drinks, or anything like that sort?
Yeah. No, I have to with school and work. Yeah.
Totally understandable.
So-
How much do you think you drink per day?
I get like the big venti ones from Starbucks, so
Okay.
like probably like twice a day.
Twice a day?
Yeah.
Okay, that's not so bad. I mean, it's as long as it's not disrupting your regular life or your sleep, right?
I mean, sleep. So about that sleep.
Yeah, about the
So,
sleep. Okay.
Yeah, so like I don't know, it's like the stress is just like causing me to like have some sleep issues, like with the burning stomach, and like I get really itchy, but like I don't sleep anymore. Like it's so messed up. Like I'll sleep like 4 hours here and then like 2 hours there. It's just like whenever it works.
Yeah,
So,
and that's hard because you definitely need the rest to,
So,
help
yeah.
recoup and get your body refreshed for the next
I
day.
know, but I
So
mean, like, there's just like so much to do. So like,
Yeah.
I have to get it all done, and then I'll sleep later. Like, I'll figure it out later.
yeah, I totally hear you there. The school and the work life can be very stressful.
Mm-hmm.
Is there any tobacco use for you?
No.
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 Okay. And then, do you drink? Any alcohol?
Yeah, I mean, like, you kind of have to every once in a while. So probably just like with my friends on the weekends.
Okay. So would you
Somewhere.
say probably like one per day?
Yeah,
Is that-
sometimes I do have wine to myself, but I mean, like, the Bachelorette is on Monday, so like I
yeah,
have to.
no
so.
problem. Okay. So then, do you think alcohol has been a concern for you, or anyone else concerned about you and your alcohol use, or do you think you're within normal?
No, I mean, like, I think it's okay. No one's ever said anything at all, so I think
Okay.
I'm okay. Yeah.
Sounds good. And then, any drug use that I should know about, or have you used any needles to inject drugs?
No.
No. Okay, great. And then, are you sexually active?
Yeah, so that's what the birth control is for. So.
Okay, sounds good. Then you're using the right thing. And then, do you have any sexual concerns?
No.
No.
No,
Okay.
I'm good. Yeah.
Okay. And then, are you satisfied with your weight?
I am now. Yes. Mhm.
Great. Okay. And then, how's your diet? Would you rate it good, fair, poor?
It's okay. Like, I would say probably fair, because,
Okay.
like, school, like, you kind of just, like, eat when you can, all that
Yeah.
kinds of stuff.
Mm-hmm.
But I mean, like, it'll get better, like, once I figure out my schedule and stuff.
Yeah.
Yeah.
Okay. And then do you exercise regularly?
Yeah, I walk a lot. I walk
Okay.
as much as I can. So.
That's great. It's
Yeah.
always good to stay moving, get that blood flowing.
Mm-hmm. Yeah.
Okay, so do you use seat belts consistently?
Yeah.
Okay,
I kind
great.
of have to, or else my
Great.
heart like dings all the time.
Yeah, we just like to ask a couple questions about safety just to kind of get the background on that as well.
Okay.
Do you have any concerns at home for violence or like any violence concerns?
No, I
No?
live with my sister. I mean,
Okay.
she's teeny. She's not
She's
that
teeny,
violent.
not aggressive?
No, it's not aggressive.
Okay,
No.
and then have you ever been abused?
No, I
No?
have not.
Okay. And have you completed a living will or durable power of attorney for healthcare?
No,
No?
probably not. I don't think so.
I
I feel
know
like-
it's not. I mean, a lot of us young folks feel like it's not very necessary. But if you would like some information, it's definitely something that doesn't hurt to have. It's always good for your family to know what wishes you have, and
Okay.
So if it's something that you would need more information about, just let us know, and then we can connect you with the right resources. Okay.
Okay, cool.
Okay, and then just the last bit of information I'd like from you is just what do you do for a living? Do you have any occupations, like a job right now or anything?
Yeah, I work as a CNA right now.
Okay,
too.
nice. At what hospital?
At Good Samaritan Hospital.
Oh,
It's really
nice.
fun. Advocate
Very
family.
nice.
Yeah.
Good practice for nursing.
Mm-hmm.
And then you're in nursing school, so you're a student,
Mhm.
and you're going, or you're CNA at Good Samaritan. Great.
Mm-hmm.
And then what's the highest level of education that you've completed?
I got my bachelor's already in biology.
Very nice.
Mm-hmm.
Very nice. And then marital status, single, married, divorced?
I'm single.
Single, okay. And then you said no children.
Yeah. Mm-hmm.
And then you said you live with your sister.
Yeah.
Okay. And then do you feel like you have a good support system in the
Oh
area?
yeah, totally. Like
Great.
my parents live in Downers Grove. I live in Downers Grove.
Okay.
My brother's off at school, but I mean, like he's
All the
with her.
family's pretty around.
Mhm.
Okay.
Yeah, we're
that's
pretty
great.
tight. Yeah.
Great. And then any spiritual religious practices that you'd like us to consider when giving you treatment?
I mean, like I'm Catholic, so
Okay.
that really doesn't like affect me. I
Mhm.
mean, it's just what I
Nothing
identify
special.
as. Yeah, nothing,
Okay.
nothing special. Yeah.
Alrighty, sounds good. Well, thanks so much, Erica. It was very
Oh,
nice to
thank you,
meet you. I'll go
Mary.
ahead and relay this information to the doctor, and
Okay.
then we'll get started with some treatment for you. Okay?
Awesome. Thank you so much.
Thank you.
Yes. What up, Miss Bourne? We're done.
Yes, yes.